Hi, everyone. Welcome to today's session. Thank you so much for joining us. My name is Christine. I'm a member of the CASN National Office staff. Before we get going with today's presentation, I'm just going to go over a couple of housekeeping items. So we're going to start today with the presentation from our speakers, and we'll have time for question and answers at the end of the presentation. You're going to be kept on mute throughout the presentation to prevent any disruption from background noise. If you would like to discuss something with the presenters at the end, please press the raise hand button. I'll call out your name and unmute you so that you can ask your question. I would ask that if your question is asked by someone else, that you press the lower hand button so that we can get through as many unique questions as possible. Today's presentation is part of a CASN webinar series to support knowledge exchange amongst nurse educators during the COVID-19 pandemic. The response to COVID-19 by nurse educators is going to be the theme of this year's annual Lunch and Learn series, with presentations on online learning, virtual simulation for clinical, and leadership in uncertain times. More information about the 2020-2021 Lunch and Learn series, which is going to be happening from September into the spring of next year, is going to be posted soon on the CASN website. So if you would like to present your own webinar, keep this in mind. Now I'd like to introduce today's presenters, Morgan Magnuson and Shannon Vandenberg. Morgan and Shannon are both nurse educators in the Faculty of Health Sciences at the University of Lethbridge in Alberta. Their backgrounds in public health nursing have enabled them to bring public health issues and the importance of the social determinants of health into the courses they teach, helping students gain a practical understanding of relevant health issues in Canada and around the world. They teach a variety of courses, but primarily teach community health nursing theory and practice, as well as a global health issues course. Morgan and Shannon strive to promote excellence in teaching by creating innovative teaching strategies to engage students, particularly in the exceptional circumstances that we are dealing with now in the pandemic. Personally, I've had the pleasure of working with Shannon and Morgan on CASN's Climate-Driven Infectious Disease Project. They've done an amazing job bringing their creativity to the e-resource that we're developing, and I'm really excited to learn about the teaching tool that they're going to be talking about today. For those of you who are just joining us, welcome, and I'm going to now turn things over to Morgan and Shannon.
Thank you, Christine. All right, just want to say thank you to everyone for joining us. We weren't sure how many people would join us on this first week in August, where we just came out of a long weekend. Sometimes people tack on a few extra holidays to long weekends. So we're pleased that so many of you have joined us today. And we wanted to just share something that we've been doing in our program for a few years now. And Morgan and I adapted it somewhat to make it more virtually based because of the situation that we're in here across Canada, where probably many of you are in similar situations as we are, where we have to adapt and move all of our courses online. And Morgan and I also have to move our community health practice course online for the fall. So this is a unique challenge, right, where students are accustomed to going out, working with populations out in the community, and now we're tasked with trying to give them, we can't give them the same experience, but give them enough knowledge and skills that hopefully they can gain an appreciation for community health nursing. And so we've come up with some unique ideas that we will be implementing with our students. And one of them that we thought might be interesting, or that others might be interested in across Canada, is the virtual community-based scavenger hunt. So if you just want to go to the next slide, Morgan. So just some history to this resource. Our colleague, Lisa Howard, actually developed the initial activity that we had students go on an actual scavenger hunt in Lethbridge. So that's the community that we're in, is Lethbridge, a city of, how many thousand are we? 100,000, I think.
We're about 100,000.
Yeah, 100,000 people is the center that most of our community health experiences are in. We do have some rural communities that we go out into, but essentially students would have to utilize public transportation in Lethbridge and try and locate community resources for a case individual that we gave them. And we'll talk a little bit more about that in the webinar. We find in our situation, many of our students use their own vehicles for transportation. So many of them use their own vehicles to get around. Our transit system in Lethbridge isn't probably the best in Canada. So there's lots of challenges with using public transit. And so most of our students actually use their own vehicles, and very few use public transit. So this initial activity that we've done in our course was where students actually had to navigate the transit system. So many of them have never used it before. So they actually had to start at the university and figure out, which bus they should be taking, where they should be going, where do they need to go, how do they need to get back. So that in itself was a challenge for students, and a really good challenge for them to understand some of the barriers for some of the populations that rely on public transit. So for instance, to access medical appointments, right? All of the additional challenges that people face when using public transit. So just a note of thanks to Lisa, who did develop the initial activity, and we've adapted it somewhat also to make it available virtually. So what is the community-based scavenger hunt? It's an activity with real, so community-based and virtual computer-based components. So with the virtual aspect, the real aspect becomes virtual as well, where students are provided with a case scenario of an individual and highlighting some of the challenges that that individual may face. So how we've done it in the past is we've partnered students up, so they work with a partner and they're each given a different case individual that they assume the identity for when completing this activity. And we have 6 case scenarios in this activity represent Indigenous populations, seniors, youth, single parents, new Canadians, the physically disabled. And these are populations that we see in Lethbridge. Morgan's going to talk a little bit more about the scenarios in a little bit here, but those are some of the populations that we serve in Lethbridge, so that's why we've chosen those. So students must work through the scenario and solve challenges as if they were that person. So they need to think about what some of the challenges would be if they were that individual, and also think about the influence of physical, economic, social, and service environments for that individual. So what are some of the unique challenges that they would face? And then students must identify various community resources that are available to assist and support their case individual. So what we found, and some history behind the activity, is we find, and many of you that teach in community health nursing, you might hear similar stories as some of the experiences that we've had, is that our students, for the first 2 years of their nursing program, all of their practice experiences acute based. So they're in the hospital for most of it. And then in their 3rd or 4th year, they come to us for a semester and do a semester of community health nursing. And for many of them, they had no idea that there's a world outside the hospital. They were so used to just being in the hospital, having their patients, and they didn't really think about what happened to people before what happened to people, that they ended up in the hospital, and also what happens to someone after they're discharged from the hospital. So many of them have no idea that there's this entire complex web of services and resources and community health agencies available to people outside the hospital. So we found that was a challenge for our students, is when we would ask the students, what resources are available in our community that might help this individual or might help your patient. They had no idea. They had no idea some of these resources existed. And so that's really part of this activity, is to get students thinking about what type of resources are in our community that might assist some of these populations. And then secondly, the second part of the activity is where students use online resources to explore how policies or lack of policy shape the experience of the social determinants of health for their case individual. So really looking at some of the barriers in terms of policy and tying that back to social determinants of health for each of the individuals in the cases. So the goal is to support undergraduate nursing students in their community health practice placements to understand the role of local economic factors, urban planning, community resources, and government policies, which act as enablers or barriers to shape various populations' experiences of the social determinants of health that influence their overall health and well-being. So really, the goal is for students to understand, what are some of the factors that shape some of the barriers for these populations? What are some of the assets that these populations have that they can rely on? But really trying to think about social determinants of health and how do they influence populations in Canada. And then the objectives. So we want students to identify the role of local economic factors, again, urban planning, community resources, and government policies, again, which act as enablers and barriers to shape various populations' experiences of the social determinants of health. Look at local conditions that influence social determinants for the different groups that we have in our scenarios. So really thinking about the local context. Sometimes students are, if they're in a theory course, they're talking about groups in a general way, but this is really getting students into their own communities. So what are some of the challenges in our community for some of these groups? What are some of the resources available in our community for these groups of people? Looking at system level guidelines and policies influencing the health of, again, different populations in our cases. And some of the the greatest awareness that we've found in students is their ability to understand that there is this entire complex web of community resources available that they had no idea existed before their community health practice course. And so it really helps them gain awareness of these resources. So when they go off into their next experience, or when they finish and they become practicing nurses, they know that there's these resources available in their community that they can point their patients to. Did you know this existed? You can access them for help with funding, or this program provides excellent information on diabetes education, for instance. So many of these resources then that they can rely on in their future practice. And then for the second part of the activity, it really helps students to think about how do they search for information online, where can they find some of this information, and then to tie it back into the social determinants of health in their case individual. So benefits to students, we always want to try and engage students in experiential learning. Again, we have to adapt and modify activities with the environment that we're in. But we felt that this was still an activity that can be achieved virtually. So instead of actually using public transit to go out into the community, students now have to think about how else can I access community resources? How else might I find out about different community resources that exist? So really trying to ground them into their own communities and so that they understand what's out there, what's happening around them. It helps challenge students' assumptions about different populations. So we know that there's sometimes stereotypes about different populations, but this really forces them to think about some of the factors like the social determinants of health. How does that influence that population's overall health and well-being? What assets do they have that they can use when navigating the healthcare system? It also helps explore the social determinants of health in a creative manner. So it helps them really tie them back to something, because we talk about them in theory. And it's one thing to talk about the social determinants of health, but this really helps the students actually apply them to a specific population or an individual where they can see how they relate. As I mentioned before, it helps familiarize students with their communities and populations. Helps refine critical perceptual and thinking skills for community level assessment. So again, they really need to think about their community, where might they go for information, where are they going to find some of these resources and agencies, where will they look. It provides students an opportunity to walk in the shoes of an individual, of a different population. So even though, again, they don't have an opportunity to use transit and actually complete the actual or real scavenger hunt, they're still taking on that image of that person. So what if I am this person? These are my challenges. What am I going to do now? And then it helps facilitate an understanding of health as a product of local conditions, government policy, and political will. So really getting students to think about that relationship between policy, government, what's happening, and how does that shape the health and well-being of different populations in our communities. And as I mentioned, we integrate the social determinants of health. We use the McConan and Raphael document, the Canadian facts, and they, as you probably know, the primary factors that shape the health of Canadians include the living conditions they experience and a variety of different social determinants of health. So Morgan's going to talk a little bit more about the actual case scenarios, and that's where we want each person to think about the clues as if you were a person or a member of the population, and to think about how the social determinants of health might influence you.
Okay, so I'm going to keep my video off because my internet connection's not great. But if I start to cut out, Shannon, maybe you can wave at me or something.
Okay, I can turn my, okay.
Well, we'll see. Let me know if I start to cut out.
Okay.
Okay, so we created 6 case individuals that represent equity-seeking groups in the community of Lethbridge. So although these are the populations that we would serve in Lethbridge, I think that these clients could be easily adapted to meet the needs of your local context. I'm going to briefly go through each client. For each client, students are asked to put themselves in the client's shoes. And in the first part of the activity, the students are asked to identify at least 4 local community services online that may help their clients address some of the concerns they have or improve the quality of the social determinants of health in their life. Students are also asked to think about some critical questions they could tie into the social determinants of health and to the community services that they find online. So our first client is a new Canadian. Lethbridge has over 3,000 recently landed immigrants in their general population of about 100,000. So our new Canadian speaks and reads little English. They rely on public transportation, and they have an education that's not recognized in the current complex and often frustrating system associated with qualification recognition. So our new Canadian also has potentially protective factors in their faith. And your goal as that client is to receive English language training and other employment supports. Our second client is a new mother, currently living in an emergency shelter in Lethbridge. She has quite complex needs as she has little financial resources. She takes public transport. She is already connected to counseling services, but she still needs to obtain employment, childcare, and other services geared towards single parents and children. Our third client is a young person experiencing homelessness. Lethbridge, like I'm sure other cities, struggles with affordable and supportive housing, and there's often not enough emergency shelters to meet our needs. In addition to experiencing homelessness, our client is also HIV positive. They have potentially protective factors in their social network, and their goal is to become housed and one day to help others who have been homeless. Our fourth client is a senior. So despite being a college town, Lethbridge also has a large proportion of seniors in its population. Our client is also struggling with finances, can no longer drive, and is also widowed. They have troubles with their renal function, but our client loves to volunteer and has many friends, and in addition to their faith, which should serve as some protective factors. Our fifth scenario is an Indigenous woman. The University of Lethbridge is located on traditional Blackfoot territory and is home to many Blackfoot and other Indigenous people. Our client has a GED, is employed, and enjoys artistic activities. they don't have access to a vehicle, and they do have a family history of mental health issues. This client is interested in furthering their education and becoming more involved with their heritage and culture. And our last client we created was a person who has a disability. They are currently on AISH and attending college. They have good organizational skills and they excel at sports. They also have a heart condition in addition to sight and hearing issues. So we give each of our students a case study and a worksheet to work through what services they may access online. Again, thinking about the perspective of the client in their case study. So thinking about what barriers they may face as they try to access those services. We also have them link the services the community organization may provide with what social determinants of health it is acting on. So again, our goal is to get them familiar with what community organizations exist in our community. And in the second half of the activity, we dive deeper into the social determinants of health and how they interact with the experiences of equity-seeking populations. But this time we're having them think about what their role would be as a nurse. So in each of the second parts of the activity, we have provided them with a resource to review, so an article or a report. So in the first one, again, working with our new Canadian, we prompt them with questions that get them thinking about the population and then bring the conversation back around to the social determinants of health. So here we are asking students to think about the country of origin for many of the new Canadians that come to Lethbridge. We ask them about how new Canadians' health changes over time. We then ask them critical thinking questions about how the immigration system, the current system, may impact the health of new Canadians when they come to Canada. For our single mother, we ask students to review an article that discusses how public policy influences the social determinants of health of Canadian women and pull out some of the key issues in the article. We also get them thinking about how the social determinants of health interact and the negative consequences on how those negative consequences on health often overlap and compound. Again, thinking about the role of the community health nurse, we ask students to think about what is their role in addressing child poverty. We also take this case now to a global level by asking them to review the WHO document, Closing the Gap in a Generation. And that document discusses health inequity and the social determinants of health from a global perspective. For our senior population, we ask the students a few basic questions to further their understanding of this population. So we have them look at a little bit of demographic data. We also start them thinking about how poverty might impact this group, as well as the other social determinants of health. And lastly, we also bring it back to thinking about healthy public policy. When we have students thinking about working with Indigenous populations, we want them to think about the social determinants of health that are specific to this population. So we point them in the direction of the National Collaborating Centre for Aboriginal Health report on health inequities and the social determinants. We have students explore issues of social exclusion, lateral violence, and poverty, and how these factors impact the health of Indigenous people in our community. Lastly, we ask students to think about how they can support people who may have a disability. We also bring this case study out to a global perspective by including a report on healthy aging for adults with intellectual disabilities and physical health issues that was done by the WHO. We also have them explore an article that specifically addressed the social determinants of health that impact people with disabilities. So after the students have completed the first and second parts of the case studies, we would then have a large group discussion about their experience with the activity and any findings they have. So we've listed a few critical thinking questions here that link the social determinants of health to healthy public policy. What's the role of the nurse in advocating for healthy public policy? The impact of our local context in terms of economic factors in city planning, and what that has an impact on the health of the people that live in our community, and also how community resources can be used to help the people that live in Lethbridge. But because each case study is fairly unique, I think it would be easy to adapt these questions to meet your needs.
And then just a note with the debriefing. So when we've done the activity in the real world, we come together obviously to debrief afterward. We give each student group an opportunity to talk about their individual, because often students are only given one individual and then they can learn from others. You could have students do all of them if you chose. We've done it where we give each group of students one. We usually have 12 students in our clinical group, so we pair them up. It works really well. And then we spend, some time afterward to talk about some of those questions. But again, in the virtual world that we're going to be in the fall, it's easy to adapt and create a debriefing session on Zoom, where you give the students a timeline to complete the activity, and then you would bring all of your students onto Zoom and give each student or student group, again, if they're working in pairs online, or if you find it easier for the students to work alone, where they're able to share and discuss through a platform online. And then, so that's really essentially what the activity looks like. So when we've done it in real time, it usually takes students usually about a day. We give them a half a day usually to, if we were using transit, having them, usually about half a day to go out and find some of these resources. Depending on students' familiarity with their community, if they're doing it virtually, it might maybe even make it more challenging to find things online, right? Because now they're tasked with trying to find some of these resources online. So relying on their searching skills, and if they're very unfamiliar with their community, it might take a little bit more effort. If they're very familiar with the community and know some of these resources that exist, if students are very familiar with with some of the resources, I always encourage them to find other ones. So for instance, if they're very familiar with many agencies that service seniors, what can you find some unique ones that maybe you don't know about? So again, depending on how well students do at searching online, it could take them a few hours. And then for the second aspect, again, depending on how much time it takes students to go through the information, again, usually about a half a day is what we give them. So it could be a full day of clinical to do this activity. And you can debrief at the end of the day, or you can have students think about it and debrief the following day, whatever really works. Everyone's programs are slightly different. So, and again, you can adapt the scenarios to your community. We are willing to share the scenarios with you as participants. If you wanted to use any of it in your programs, we're certainly willing to share that. So we just open it up if anyone has any questions or thoughts or any items that they want to raise. And our question for you is, how might you be able to utilize this community-based scavenger hunt in your education programs?
So if anyone does want to chat, they can press the raise hand button and I can unmute you to ask your question. All right, we have Karen Jenkins. I'm going to unmute you. Go ahead, Karen.
Okay, can you hear me?
Yeah.
Okay, perfect. I'm just curious, you said you hadn't done this yet virtually. So are you thinking about bringing the group back together to debrief in small groups of like practice groups of groups of 12? Or are you thinking about the whole class coming back together? Like, how are you envisioning that part of it?
Yeah, so our community section, so our practice courses have 12 students. So we would be the individual instructor for those 12 students. So what we are thinking, so we're going to be using this in the fall. So what we're planning to do then is divide our students into groups of 2 so that they would work with a partner, and then they would be given one of the case individuals to work through. And then after all the students have completed the activity, then we would create a discussion within our clinical group of 12 students so that they would all learn from each other.
Okay, sorry, I just needed to clarify because we do something similar and we've had them come back as a large group and we're just trying to figure out how to do that. So that makes sense. Thank you.
Yeah, you could do it with a larger group, I guess, too. If you were thinking about using something like this in a theory course, or maybe you have like 30 students, you can always give students the same scenario, right? That they would work through the same scenario as another student. And then in your large group discussion, it might be kind of interesting because different groups might have found different resources, and then you can have a discussion about that. So it can really work different ways.
Thank you.
You're welcome.
There are a few like questions in the chat box too. Should we answer those? So someone asked, is the assignment graded? So traditionally this has happened within our clinical groups. So it's a pass fail. So it hasn't been graded before, and in the way that we're going to use it in the fall will also not be graded.
But it could be adapted, I guess, right? If you want to grade it as part of an assignment, you could quite easily create a grading tool to accompany it.
Yeah, so I guess we evaluate it more broadly through our clinical evaluation tools. So this will just be one example of the way that students meet the course outcomes using our clinical evaluation tool as kind of a guideline for that.
Oh, I have another hand up. So Patricia King, I'm going to unmute you. Go ahead, Patricia.
Hi, can you hear me?
Yep.
Yeah, I'm from Saskatchewan. I'm just curious if you've had any experience where students are in a group and the group that they're assigned represents their own lived experience.
Yes, so that has happened to me, not on obviously virtual because we were doing it first time in the fall, but I have in the past when we were doing it in person. And, you know, in terms of how that was the learning experience, it was, that certainly adds a more deeper understanding when you can bring individual lived experience to the group. But I also always give students a chance to opt out of if they're if they're part of that population and don't feel comfortable approaching the activity from that perspective. So.
Okay, thank you.
And one other piece we always add, and we forgot to put that in the debriefing, but we always, before we do any type of debriefing, if we're doing an activity like this, we tell students it's a safe place, make sure you're respectful of others. You know, we don't know where people come from, we don't know people's experiences, but it helps students to understand a little bit better what some of these populations face, right? What are some of the challenges? And we can see that how that impacts health. So really gives students a better understanding of some of the people that they work with.
Okay, we have another hand up. Patricia Kavanaugh Beasley, I'm going to unmute you and go ahead with your question. Oh, I think you have to unmute yourself.
Oh, sorry, I did. Sorry, thank you for taking my question. I just put something in the chat box that I think was kind of vague, so I was considering, and sorry, I joined a little late. If we're doing this group online activity, I'm trying to think of my students. I'm also a faculty advisor at Centennial College in Scarborough, in Toronto. So how would that work in terms of putting them in groups to do the activity when they're going out by transit or whatever, if many of our students may be working, going to school online and may not be in the same town? Like, does that make sense?
Yeah.
I'm just trying to wrap my head around that, and I don't even know what the scenario is going to look like yet, because I don't have my assignment for my students yet. I guess they would do it individually, I assume, or have you considered that?
Yeah, so there's two different ways. So traditionally how we've done it is we've done the real based where students use transit, they go off because they're all together in a group in a
Yep, I get it.
in our traditional way that we've done clinical, right? Where you're getting together and that's where we pair them up. But now that we've moved to virtual, I think what we're planning to do in the fall is eliminate the public transit piece because it makes it hard, right? You're right, students might not even be in Lethbridge for their clinical experience, right? They might be in Ontario, they're doing everything online. So that's where we would eliminate that piece. So we were talking about how we've used it in the past, but now going forward in this virtual world, it would have to be doing it online. So finding these agencies, you know, through Google search or however else students want to try and figure out what agencies exist in their community. The transit piece was always interesting and exciting for students and a unique challenge.
Absolutely, that's such a, I mean, I've done walking tours in downtown Toronto and that was a pivotal piece because there were the unexpected surprises along the way, right? That one didn't consider. Another good idea, I'm not that savvy, is you can do these Google map tours. So you can actually do these virtual walking things if you put addresses in. So I guess we have to get further creative on that, but thank you for taking my question.
Can I just add to that too, Shannon? So I think the way that we'll manage, so requiring students to be online for the debrief and to work as a group is that even though our community clinical is online, it's still synchronous. So I think if it was asynchronous, it may be a little bit more difficult to have those large group discussions in Zoom, but because our community clinical, despite being online, is staying synchronous, we just have specific times later in the week that students will be required to be on Zoom to do these sorts of activities.
Thank you. Can I ask another question, or are there many other people behind me?
No one else has their hand raised right now, so you can go ahead.
I have a question about debriefing. Debriefing, in my limited experience, I've been doing some simulation the past 2 years, can be a challenge with having students feel safe and be engaged and share opinions. I'm just assuming, so this has not been done online by any of you. So have you given any thought as to how debriefing may change via online format like Zoom via face-to-face?
I think that's a challenge with anything, right? And you're right, we haven't done this online. We think it could work quite well, but the debriefing piece, I think you're right, with any type of simulation or activity, trying to debrief online is always a challenge, right? How do you make students feel safe in an online way, right? How do you manage that, right? We're not sitting, with our students in a room that you can really pay attention to body language and all of that. So I think having some very clear and consistent guidelines before debriefing, where again, to reinforce that students need to be respectful and that it is a safe way, should be a safe environment. If students, need to leave, or if something, that they need to step out, that they're free to do that, right? To go offline and come back when they're ready. I think we need to be very mindful of that with students. But to be honest, this is our first time doing community health clinical online. So, we have no idea what we're in for, right? I think we're all kind of learning together. So.
Sorry, and I joined late, so I was thinking the whole time, did they do this yet, or was there a testing? So I totally, not putting you on the spot.
No, that's a really good question, right? It's something that I've thought of too, right? How do we really engage students? How do you really engage students on Zoom, right? There's always going to be those that are more engaged and those that aren't engaged. And we see that in a classroom too, right? But with some of these activities, we have used this activity in the real world where we've actually had the students go out and then we come back together as a group. But we're going to be doing it virtually this fall too. So we're going to be learning along with everyone else.
I guess what I'm thinking is, I was talking to someone, when I teach a group online, I do prenatal or parenting classes, when people don't use their camera or mute, there's all these little social nuances, complexities now that impact just communication. So I'm really interested in that. So perhaps when you come up with the ways of amazing debriefing for online formats, you can have another webinar. Thank you.
No, I don't think we're experts in that. I took the Couldnt course this summer, the virtual simulation, and there was a lot of good information about debriefing in there, right, that I hadn't thought of myself, but I'm certainly no expert.
Yeah. Well, thank you for answering my multiple questions. Thanks a lot.
Thanks.
There's just one question. I'm scanning the Q&A box about if you guys have invited guest speakers for community services to participate.
So that's something that we've built into our theory class more so than our clinical. So within the context of this activity, we have not done that because we kind of get supplemented by some of those community services coming into our theory classroom. But I think if possible, that'd be great. I also could see that happening, you know, within the context of the pandemic right now, potentially doing some of that virtually too. So I think it would be a great idea to get in guest speakers and have them participate in that debriefing session, if that was possible.
Practice. Oh, sorry, Morgan, you cut out.
Oh, was I just talking to nobody?
Yeah, you were just talking to no one.
Okay, you can go ahead then.
No, you can finish what you were saying.
I don't know where I left off.
I think you were talking about potentially having people.
Yeah.
In the virtual.
Yeah. So because we normally do that in our theory, we haven't, but this will be a different year for us. And so I think there is an opportunity in that debriefing period. It would be great to have community services come in and give a little more information about the services that they provide. So I think that'd be really good for students to be exposed to that as well. So I think there's opportunity there on Zoom.
Mm-hmm. What I was going to say when you cut out, Morgan, was that the challenge for us is that our clinical, we have, I think, how many groups this fall? 10 or 12 clinical groups. Yeah. They run on opposite ends of the week. So unless we can get all the students together at once, we try and reduce the amount of times if we're going to have guest speakers that they need to come or present. We don't want to burn them out, right? If they have to come 12 times in a semester, that's a lot. So in our theory classes, then that's where we have larger numbers, so usually 30 or 40, and that's why we've done the guest speakers in those classes, just to reduce the number of times that they need to come. But there's many opportunities, right, where we can video their presentations and post them on Moodle, so there's different ways that we could certainly go about that in the online environment.
I'll just see if there's any last question. Oh, I think there's a new one in the Q&A. Is your clinical completely online, and how many hours?
So it is completely online, and we are not basing it off of hours. We are basing it off of course outcomes. So there is no designated hours of work that they need to put in, but we are expecting our students to be online for the majority of 2 days a week, like 2 shifts. So I think we have our first initial Zoom meeting with them at 9, and then a check-in at the end of day 1, check-in in the beginning of day 2, and then like kind of a post-conference on the end of day 2. Did I answer that? Okay, Shannon?
I think so. I was just thinking, you know, it's so different, and it's always interesting to hear what other people are doing as well. You know, we were really, I guess, upset at first when we found out we would have to go completely online, just because it's been a huge challenge, right, to try and think about how do we teach community health clinical online, solely online, right? How do we try and give our students a good experience online when they don't get to go out into a community and engage with people? And so all of these factors. So, you know, it'll be really interesting to see how the fall rolls out. I don't know, are most of you doing your clinical entirely online? Are people still going out into practice settings this fall?
There's a few hands got up. Okay, Karen Jenkins, I'm going to, you go ahead. I think you just have to unmute.
There we go. We haven't been told yet, but so it's been really difficult for us kind of hanging in limbo about how we're going to prepare. I would love to hear more about how you are planning to conduct every single week online in the community practice course you're doing. So I don't know what others have if we have time for that, but maybe we can see what the other questions are and come back to it.
Okay.
I'm seeing a lot of responses in the Q&A. Some people are waiting to hear, some people are half and half. Catherine said they're online at the University of Windsor. Looks like a relatively mixed bag at this point.
Mm-hmm. It's always interesting just to hear what others are doing, right?
But I would be so stressed out if I was some of you and we're still in limbo about it. As disappointing it was to hear that we would all be online, it has left us the summer to plan. So do you want to should I talk a little bit about briefly what we're doing, Shannon?
Sure, because you did a lot of the 12-week plan.
Yeah, so, and I should say that we, our colleagues at Athabasca University, we kind of followed a similar, they are online for that. So we kind of followed suit with what they did. They were very generous in giving us a lot of their information, but essentially we're giving them a population of people to work through. So again, like case study based, and then they'll still work through the community health nursing process. So we're still having them complete an assessment, although there'll be no clients. They'll do a secondary data search, and we'll have them priority set, plan an intervention, present the intervention to their peers, and then go through an evaluation of that. So we also have them working through the nursing process. And then we're also just throwing in little bumps in the road as they progress through the population. So we are having a week where the population they're working with experiences a pandemic like COVID-19. We're having a week where we think about maternal child health in relation to the population they're working with. A week where, what do we have an outbreak of? There's an outbreak of,
was it the outbreak of TB, or was that a different?
Yeah, right. Yeah, an outbreak of TB. So yeah, we're kind of having kind of specialized week where we go through some of that kind of specific role of the community health nurse. So by the end of it, it was quite busy. I think the students will be busy, and that's me saying it when we haven't done it yet. But
I think there's also influenza, right, where they experience
influenza. Right, yeah.
We always, that's always part of our fall where we, where a lot of our students are involved in the influenza immunization clinics in the community. So again, they won't have that opportunity, but we still want to give them that information because it's really the only time that we talk about that in our program in this much depth. So that's another aspect that we're going to be going over. So like Morgan says, we don't really know how it's going to roll out, but that's sort of how we have it planned right now.
Are there any other questions from people?
How do we get the materials that you so generously said you'd share?
Yeah, Christine, does that come through you then, since you have the information from the participants? Do we give you that?
Yeah, if you send me the materials, I can send them to everyone who registered for the webinar.
Okay, we'll do that. That way, if you want to use any of it or if you want to adapt it, then you're free to do so.
Can I be totally transparent and honest? I couldn't register, but I really wanted to get on this. So my colleague who's at Ryerson sent me the link. So I feel like I cheated, but can it be sent to me if I provide my email?
Yes, of course. We just have the registration so that we have people's emails to share the link. We're not trying to restrict registration in any way. So
I'm glad I got that off my chest. Thank you.
No problem. I'm going to take down your email address so I can make sure that it gets to you. All right. Well, if there's no other questions or comments, I'll maybe just say thank you, a huge thank you to everyone, from everyone to Shannon and Morgan for the presentation and discussion afterwards. I think I'm sure it's been very helpful to everyone that's on this webinar. And I also want to just wish everyone luck planning for the upcoming fall and winter semesters. All the best to you. And thank you so much for attending today.
Yeah, thank you, everyone. We appreciate your questions and thoughts and things for us to think about too, because we certainly don't have all the answers for the fall.
Thanks, everyone.
Take care, everyone. Enjoy the rest of your day.